We're going to measure wrist flexion, active and passive range of motion. The starting or zero position is we're going to use the third metacarpal as our indicator or distal segment to align our goniometer, and then we're going to use the midline of the ulna. So our zero position is those two structures should be parallel with one another. All right, we're going to have you bring your wrist down towards the floor. We want to make sure that the fingers are relaxed. We want to make sure that the elbow is flexed to avoid having restriction or adaptive shortening of the extensor digitorum, limiting wrist flexion. So again, this is an active measurement. So aligned with the ulna, and then the edge of, you can either use this line or the edge of the goniometer is going to be parallel with the third metacarpal, and you can usually clearly see the dorsum of the third metacarpal for that alignment. Passively, back to the zero position, apply overpressure, spring against the barrier. We can estimate at 85 degrees, and then we're going to use those same landmarks. The reason we don't use the fifth, or don't recommend using the fifth metacarpal, is because you can get all sorts of fifth carpometacarpal joint mobility, and if you're not careful about overpressure, you can get flexion at the carpometacarpal joint, which can add 10-15 degrees of what is perceived as wrist flexion, but it's actually just mobility of the carpometacarpal joint. So that's why we recommend using the third metacarpal as our distal or indicator segment.